Hello, I'm Mick Hoopert, and I'm the President and Chief Executive Officer of Community Health Connections, Inc., which is a federally qualified community health center located in Fitchburg, Massachusetts. As a federally qualified health center, we provide comprehensive medical, dental, and behavioral health services to a significant number of patients in north central Massachusetts. Many times these are patients who are only recently covered with health insurance and may not have had an opportunity to get comprehensive health care in the past. We provide care to approximately 25,000 families across this region. We're very proud of that fact, and it's been very exciting to develop the programs that we have. One program which perhaps isn't appreciated or understood as well as it could be is our involvement in training the next generation of health professionals. And the area where we excel at is hosting the Family Medicine Residency program from the University of Massachusetts in Worcester. What you're going to see in a few moments is an interview that was conducted with the creator, the founder, the pioneer for that program. His name is Dr. Robert Babineau, Sr., and he's going to be interviewed in his home on Cape Cod. He's now retired, with Dr. Dan Lasser. Dan Lasser and I will be interviewing him. Dr. Lasser is the chairperson of the Department of Family Medicine and Community Health at UMASS, Worcester. Surrounding Dr. Babineau will be two of his sons and his wife. I think you will find this a really fascinating interview. And let me just tell you very briefly about Dr. Babineau. Dr. Babineau was born and brought up in Fitchburg. He went off to college and then on to medical school and became a doctor, became a family doctor. He served in the Korean conflict. And when he came back from the Korean War, he settled in Fitchburg and set up a family medicine practice. That was very important to him. He feels that providing care to the individual throughout their entire life, from birth to perhaps certainly in many cases when people die, and then to provide care to all family members and to provide that care in a community really strengthens that community and certainly helps the family and the individual as well. And so he's so committed to that that he decided in the 1970s, that he would give his practice to UMass, who at that time was developing a couple of family medicine residencies, and wished for them to establish that residency in Fitchburg. And that is what we're going to talk with Dr. Babineau about, is what motivated him to do that, what he saw happening, and why that was so important to him. So come join me as we talk with Dr. Robert Babineau, Sr.
Well, I came to Fitchburg to practice in September 1951. I had finished 8 years in the Army because in those days when the Second World War just started in the early 40s, and in the early 40s, from 43 to 46, I was at BU. Because the Army was looking to be sure they'd have doctors, they then paid us to go to med school. Yeah. So I got my education paid and then had to pay back 4 years to the service. So when I came back, I had been exposed to taking care of people, and also at one point I was at Fort Devens where we took care of the patients, the families of the children. We did a lot of obstetrics while I was there. So anyway, that's where I got what should have been my residency now, my training with patients. There was no organized residency. But at that time, I knew that I liked taking care of families. And I was subsequently involved in the name change. In those days, when I came into Fitchburg to practice, the organization I joined was called AAGP, American Academy of General Practice. Mm-hmm. And then we had a big meeting in Kansas City where the headquarters were of that group. After it had been in operation for a couple of years, they decided they wanted to change the name. Some of us did. We wanted to change it from American Academy of General Practice, which seemed awfully broad and was. Actually, some of the GPs were doing major surgery in those days. So we thought we'd like to change it with a focus on the family and call it American Academy of Family Practice. And that took place. That was probably in the 1970, early 1970s or 73. Maybe you have that date.
It was, in those days, it was uncommon for doctors to go into general practice.
Yeah, it was all specialties.
I wonder what it was that got you, that didn't deter you from becoming a GP and then a family.
I guess I just had grown up in a large family. I was the fifth child in my family of 10 children, and I had a family, and it just seemed to me that family was an important way to grow up, or have a family around you. As a matter of fact, one of my early philosophy books, the phrase I remember the most was, the family is the basic unit of society. And I believe that, still do. You look at the problems we have now in our country with the family breakdown and so forth. So I just felt that I'd like that sort of practice.
So
And-
you saw yourself
Taking care of the
tending to
whole
the
family.
health, the health of that family.
Absolutely. Yeah. And also what kind of pushed me into it, although I was already pushed, I went to Assumption College in those days where there were 2 courses you could follow, 2 tracks. One was be a priest or be a doctor. I didn't want to be a priest.
Good choice.
It's a great path into medical school. So you established your practice in Fitchburg.
In Fitchburg, right, not too far from here.
Yeah.
I rented a room in Dr. Caveney's office, who was one of the general practitioners, and I have a vague memory that in my first month in practice, I made $100 and had to pay more than that for rent.
Oh, yeah.
And then I had to borrow money from one of my friends, a doctor, because I needed supplies for the office. His name, he's gone to his great reward, it was John Hunter.
Oh, yeah.
Remember John?
And you used, and if you had inpatient work to do or deliveries, you started at the Burbank Hospital?
Yeah, we used the Burbank before the Lucy Helen. It was called the Lucy Helen those
Oh, yeah?
days, yeah.
Oh,
And then the
really?
Burbank,
Ah,
Lucy Helen Hospital.
And it was in the same location?
No, it was downtown,
Oh, really?
right near the Upper Common. It was
Uh-huh.
just a big 5-story building,
I'll be.
yeah.
And then over several years, your practice grew, and you took in associates who practiced.
I'm sorry?
You took in some associates who practiced.
I
with
did.
you.
Then another Fitchburger, Bob, I'm blocking on his name.
Bob Roy. Oh, Bob Roy.
Bob Roy, yeah. Yeah, he was a Fitchburger who trained in Miami. And he did one of the early family practice residencies in Miami with Lynn Carmichael.
yes, yes. I'm curious, what motivated you then to use that practice, the practice with several associates like
All right,
Roy?
well, at that time, I was a member of the American Academy, which had now been changed to family practice. And I met 2 other people who are still in my life, Fitzhugh Mayo in Virginia, and Jim Burdett, who set up a family practice program in Tennessee. You probably haven't met him because I don't know whether he's still around. And we formed, the 3 of us, under the AAFP name, were named into a research committee to look up and study the quality of medical care being delivered in those days. So you and Jim and I met with people in North Carolina who were kind of backing us up on this for a period of about a year, talking about developing family practice residencies. That's where it started. So all 3 of us went back to our areas and did develop family practice residencies. One in Virginia is very, very active. You mentioned it.
Yeah.
Fitchburg certainly has grown a lot, and I don't know about Tennessee.
And at about the same time, the state's medical school was getting started at UMass Medical School.
Yeah, UMass was just starting its medical school, yes, and I was telling Mick here that we, members of the American Academy of Family Practice, or GP, then met with Lamar Subra, who was the first dean. Yeah, so I remember that meeting very well because I don't think he was very happy to see us, but you know, who are we? But he was very pleasant and listened to our arguments for the fact that we needed more primary care. We called them family doctors, and still do, doctors in this state. And we were going to push him to, and in the paperwork that was set up to establish the med school, there was a part in there that it was supposed to be to produce primary care doctors.
And I think structurally, perhaps your meeting helped, was that it was the only school of the 4 schools in Massachusetts to have a department devoted to family medicine.
That's all. I didn't know
Yeah,
that.
no, the other 3 did not.
They did not.
I mean, they since then they perhaps have. You would know that better than I.
And as we were getting set up to do this interview, we learned that there was some kind of meeting that took place in this room in the very early years to sort of plan out how you were going to approach the medical school.
Well, I don't remember that meeting specifically, but I remember meetings here with people from North Carolina to discuss this.
Yeah.
And Fitzhugh was at that, obviously, and Jim Burdett, I think, and then local people here.
Yeah.
So we did do planning, and we all agreed that it should be office-based and practice-based, not hospital-based,
Right.
which all the specialties are.
Mm-hmm.
So we continued along with that theme.
So then you got the idea to actually put a residency program, host a residency program within your own practice.
Yeah, well, it seemed at that time I had moved I had Bob with me, and we'd moved into a new building which had plenty of space, and I had grown my practice so that we were seeing lots of patients. I felt, hey, let's go for it.
But for some people for some people in private practice that was a fairly bold and risky thing to do, to take a successful practice and suddenly bring a bunch of
never crossed my mind.
Never crossed your mind.
Because I had my patients and I got along very well, and they knew I had already begun to get students in from UMASS.
Yeah.
Certain period of time, so they were exposed somewhat to having other people examine them and talk to them. So they were very receptive, and I thank them for that.
So I understand that in the early years, you actually would, on occasion, take a medical student into your home,
Yes.
and host them while they were working in your office.
Yes, they would. I think that they were setting up the clerkship for students who were interested in family medicine. I remember one student whose name I won't mention. He was very interested. So I said, fine, come on in for a week.
He was in the first graduating class from the medical school.
Let's see, okay. So I said, look, this is what we do. If we get a call, we go out and see them. So sometimes we get called to go to the Lucy Helen because the baby's ready to be doing it. So I said, you be ready tonight when you go to bed if I have to wake you up. I said, no problem.
Oh.
We got a call. Sure enough, I had a patient at Lucy Helen who was in labor and was pretty active. So I went down and shook him and said, let's go. We go to the hospital. So I walked down my hallway, and I'm gone. I don't see him behind me. He's behind me, but he's tying his tie. I said, we're going to the hospital. You're going to take that off. Let's go. So that's what, but he was a great student and turned out to be a great doctor. We did deliver the baby.
Yeah.
And he got to assist.
Good.
So what was, when you first took residence into your practice, what was that like?
Well, I remember the thing I hated the most was I had to write up a whole description of how the residency was going to run, how we were going to do the curriculum, and that had to be submitted to AAFP, the board that made the decision. So that took me 6 to 9 months, probably 6 months, yeah.
Mm-hmm.
And then we had the selection process, and that was not a problem. But writing protocols for things don't agree with me.
I think one of the special things that I see now that the residency has 18 people in it who are residents is this sharing by the faculty and by the residents, and the patients are part of that education
Yes, oh yes,
process.
yes, yeah.
That's very special, as you pointed out, training people in the office, in the community.
Yes, yeah, yeah.
And you saw that, and you found that your patients were very willing to do
They
that.
were very willing, yeah.
And even in the early years then, when people graduated from the residency program, a certain number of them actually stuck around and became part of the medical
one of the
community.
reasons we know from watching the other residencies that people who do their residency in a certain geographic area tend to stay in the area, and that's fortunate. And this is going to provide more doctors for this area.
Right.
That's one big reason.
And so certainly at the Burbank in family medicine, it helped to grow the medical staff
Oh, absolutely. Yes.
and the whole surrounding area.
Yes.
And-
Well, my son came to join me years back, and then we've had other local people. Jimmy Floyd, who's a local boy. Yeah. So, and others have grown.
We have sites, as you may now know, not only in Fitchburg at Burbank, but we have a site over in Leominster and
I
in
just found
Gardner.
that out.
And I was over at the the Leominster site on Monday, and lo and behold, one of our graduates of 3 years ago was there,
Is that
and
so?
she's going to start working with us. And
Yeah.
she's not from Fitchburg originally, but she did her training there.
Sure.
And just as you said,
Yeah.
many of them can be recruited to stay because they have a panel of patients there,
Yeah, yeah.
and they enjoy the community.
Yeah. But as you read the local papers with the Health Care Act that's coming in, the Affordable Care Act, that Obamacare, they're going to be needing primary care physicians, and I think that this is going to help having residencies in this area, for this area.
Oh yeah, we recently expanded the size of the residency program.
Did you?
Yeah, and there's an incredible need for primary care and family doctors. Even just across central Massachusetts, even with all the graduates that we've had who have stuck around.
I do remember when I first introduced the residents at the Burbank Hospital, some of the staff there were questionable as to whether they could really do a good job taking care of patients. I think we've dissipated that feeling among most practicing physicians now.
Well, but you raise an interesting point. Most residency programs in the state were at the traditional larger teaching hospitals, and
Yes.
you developed a residency program that was based at a small community hospital in Fitchburg, and it sounds like people were fairly receptive to the idea of having students and residents around.
I think so, yes.
Yeah. So you didn't have any problems with the hospital at all.
I didn't lose a patient.
Okay. That's great.
The other thing I can tell you, since we brought down some photographs and
Yes.
some statements of goodwill, that even though you retired many years ago, you are still much loved among the staff.
Yes, I
Many
got
of
a
those-
nice note from the people up at the staff. That was a
And many of those staff have stayed with us, even though things have moved from your practice, and the UMASS connection is still there, but has now become part of the community health connections. We purposely and hoped, as we've succeeded, in keeping a lot of those staff, and they remember you very much, but they also are pleased to continue to work for a center that's involved in training of
Yes,
doctors for
yeah,
the future. And that makes people feel special, along with the mission of providing care often to people who are uninsured, as they have been in the past, but now have some insurance.
yes, yeah,
So it's a wonderful dual mission,
I think so. Yeah.
and we've built that on your shoulders.
There were lots of other shoulders around.
Well,
Jim.
that's kind of
Jim
you,
Beck.
but don't, please know that you're much appreciated and loved.
Thank you.
Yes.
So what are some of your more fondest memories of being a teacher for residents and students in family medicine?
Well, the satisfaction of dealing with young people who are energetic and eager to learn and are happy to be in the position they're in. But one of the things I remember was when we traveled down to Virginia,
Right.
as we were setting up the practice to look at the Virginia model that they had set up. And they had set up a similar model in private practices.
Right.
And the days that we visited with Hugh Mayo down there and his staff and learned how they were doing it.
Yeah.
Yeah.
And that became a model for, at least at UMass,
pretty much for us.
for having a rural practice in Barry,
That's
and
right.
an inner-city practice in Worcester, and a private practice model up in
Yeah.
up in Fitchburg, and that's the way, sort of the blueprint that was developed
Yeah.
for family medicine in central Massachusetts,
Yes.
and that still exists today with multiple kinds of training
Yeah.
sites.
Are they doing this all around the country?
Well, the funding at the present is sort of stuck, and we're beginning to see more and more student interest in family medicine, but there hasn't been a lot of growth in programs lately. We would hope that between what we're doing in Worcester and what you all are doing up in Fitchburg, that we can continue to grow and thrive in the training of primary care doctors. It's still very much part of the mission of the medical school and a critical need for the state.
How many graduates did you have going to family practice this year?
This year, UMass led the four medical schools in the state with I think 14% of the graduating
14%?
14% of the graduating class going into family.
100 graduates?
So there's now 125.
135?
Yeah. So they just grew the class over the last couple of years, partially in response to the need for more primary care doctors
Yeah.
in the state. So that's still very much part of the mission of the medical school and its residency programs.
Mm-hmm. Good.
If you could do something over again, is there something that comes to your mind that you might have done differently?
I've been around a long time, and I'm sure I made mistakes, like all of us do.
Would you have chosen a different specialty than family medicine?
No, as I said, I grew up in a large family, and I have a large family, and I think the family is critical to our nation.
And in terms of becoming a teacher and a leader, really, in family medicine, you wouldn't do that differently.
Not offhand. I enjoyed every minute. Maybe, as I said, made some mistakes, but overall, I think our graduates have done a great job wherever we've placed them.
Yeah.
Yeah, and they seem happy with their life.
Yeah.
I'm reminded with that question that Fitchburg has changed a lot since you left.
Used to be a paper town.
Yes,
Yeah.
and the paper is hard to find these days. And
Right.
it's a struggling town, it's a gritty town, you
Yeah.
know that. And there's been new populations that have come in, some of them speaking different languages, different cultures.
Yes.
And I think one of the things you'd be pleased with is that our center, with the residency and with the staff that we have been well received by those people,
Yes.
because it offers the kind of family medicine care that they know they need, and they haven't had perhaps before.
Yeah.
And they know that they can come and they will be seen. Money is not an obstacle.
Yeah.
And so I think you'd be proud of that, to see
I
that.
am. I think it's great that people who need care
Yeah.
get care, regardless of what it costs.
And the other thing we've done is that we were able to build in dental care.
Yes, I heard that from Maria.
Yeah.
And then also with family medicine being so attentive to the psychosocial or the mental health needs of people, we have a pretty strong mental health program that's really interconnected with the family medicine program. And so we provide a lot of behavioral health
Yeah,
services. And many patients do need that. I mean, we all need that from time to time. And so we've kept that tradition of family medicine, making it even more comprehensive, I think.
Yes. I remember part of the residence training was the Babin group.
Oh, yes.
I don't know whether other residencies have that sort of a group.
Well, a few do, but we have the longest running Babin group for the faculty.
We in the family practice residency?
Both within the residency and for the
And us.
faculty.
Yeah.
It's still going strong
It is, yeah.
today, emphasizing both the medical and the biologic, psychological, and the social sides of providing care for patients. And so that's been a feature of the
Why don't you
program
tell
forever.
the audience out there what Babin group is?
Well, there was, as you know, there was a Hungarian psychoanalyst named Michael Balint who worked with British general practitioners for many years to help them to become more comfortable in dealing with very difficult
Yes.
patients.
It was a support group for all the residents.
Yes.
And to sit with them and say, I had this patient the other day, I really couldn't handle it, I got mad at her.
Yeah.
So the fellow residents shared their feelings about how they were dealing.
Yeah.
Yeah, and that's continued.
And that's continued to this day, and it's a very strong part of the program. Yeah.
You know, that's the type of education that I think we haven't done very well in general. But the Ballant Group and family medicine really focused on, because
Yeah.
if you don't have people that you can talk to who are in the same spot you are and how to handle, as you said, those difficult, challenging patients, I mean, you learn from that.
Medical education's gone through several cycles. We're emphasizing primary care, not emphasizing primary care. Now, as you said, the Affordable Care Act is back, and there's more of an emphasis on primary care. It sort of raises the question: what kind of advice that you might give to somebody who's going into medical school, or for
Probably don't go. Medicine has changed radically. Of course, you probably read the New England Journal articles recently about the changes that are coming in medical practice. Team approach. Not that I'm saying team approach is not correct, but certainly there are changes. There are going to be more changes. But the focus should still be, obviously, the patient.
Oh yeah.
And you read more and more about that.
Well, let's take a group that's finishing up. They're in their third year of medical school, and let's say they were sitting here in front of you. What would you suggest in terms of a specialty for them?
I don't know what their interests are, but I have no doubt about my specialty. It's family practice. But I think we all need all specialties, obviously. But the family doctor has a key position in this team. He or she should be putting things together, coordinating consultations from other specialists, and then leading the way through this complicated, high-tech medicine we're dealing with now. And make it understandable to the patient.
Well put. Thank you.
Just a few years ago, we had a reunion back in Worcester for all the residency graduates, and we asked them the question, would you do it differently, and or what do you like about your work, and I wonder how you would feel about this. Nobody said that they would pick a different specialty, and even though they weren't necessarily making as much money as the cardiac surgeon or the orthopedic surgeon, they all said the most important thing for them was their relationship with their patients and their families.
So absolutely, yeah, and that's what's enjoyable about it. You get to know people intimately, and you can make sometimes a change in their family situation because of whatever illness or whatever is going on, and knowing them over the years, it makes it much easier to practice.
Oh, absolutely.
And you know, it makes it easier for them because they know they can come back to you. That this isn't an emergency room where you see a different doctor. You're their doctor, and they're your patient.
We've got to be careful because the emergency room physicians may object to the fact that we're kind of talking a little bit again. Don't end up in the emergency room.
I just want to say thank you so much for taking the time to be here for us to come and chat with you. You know, we respect you so much, and you've contributed so much to our region, to our state, and as you pointed out, you got involved nationally to help promote family medicine, and that's a real tribute to you. And thank you so much.
Well, thank you for coming.
Yeah, and
it was nice seeing all of you again.